I'm Dr. Richard Covert. I'm an occupational medicine specialist who has a particular interest in treating back pain. I'm in practice with the SSM Health Medical Group. My training was at St. Louis University School of Medicine. I then completed a residency in family medicine at St. John's Mercy Medical Center in St. Louis, and then I went on to do a fellowship in sports rehabilitation as well at Mercy Hospital. I then went on to complete a master's in public health at the Medical College of Wisconsin. So my inspiration for going into medicine really started with my dad. When I was just a youngster, about 4 or 5 years old, he had polio. And in those days, they didn't have the rehabilitation hospitals and the formal therapy programs like they have. And he basically had a wheelchair and a set of parallel bars. And as a 4 or 5-year-old, it was fun for me to play on those, but I really couldn't do much to help him. And as the years went by, I got involved in terms of demonstrating an interest in medicine and healthcare, and felt like I could sort of pursue that as an avenue of interest. And so I tried to combine that sort of inspiration to going into dealing with treating athletes, because I had played a lot of sports. And that sort of got me into healthcare in terms of where I'm at today. Innovations in treating backs has really sort of followed two paths. There's two trends that I see right now, one of which really is from the surgical side. And on that vein, we're seeing changes in materials, changes in implants. We're better at imaging patients, and in that sense, you can identify the patient that does need a surgical option and perform the appropriate procedure for them. The other thing that I'm seeing is we're sort of moving away from the use of narcotics, and we're trying to incorporate other options in terms of how we treat patients. In that sense, you're seeing more research coming out with regard to integrative approaches and multidisciplinary programs. And in that sense, we'll use things like yoga, cognitive behavioral therapy, as well as physical therapy. I think the thing that keeps me wanting to come to work every day is just the overarching feel that you want to help people. I want them to be able to live their best life. Having seen what my dad had gone through years ago with polio, I came to appreciate that function. Being able to, do your daily activities is a critical component in terms of people having satisfaction, managing their depression, managing stress, and managing social relationships. So when you can make a difference and have people be able to perform their activities of daily living, then you've done a good thing. And at the end of the day, that's the kind of stuff that makes me feel good.